You are here, taking those first few steps after a lung cancer diagnosis. Understandably, there's a lot to process, and at times you may even feel lost or alone. But know that you're not. Having more of the information you need is step one to having more control in your care, and that's why I'm here. Hi, my name is Anne, and I will be here to educate and guide you through the steps of a lung cancer diagnosis. While everyone's path is different, as not all lung cancers are the same, one of the most important things to do is learn as much as you can to help you have informative conversations with your healthcare team. We'll talk about several different topics in this video, which you can see in the navigation bar below. At this point, you may have done some initial research on your own or with a loved one, which is great. Knowledge is power. But it's important to seek credible sources and to know that the best information is the information that's right for you and the type of lung cancer you have. As you learn more about the type of lung cancer you have, you, your loved ones, and your healthcare team will discuss appropriate treatment options. You may have a team of several doctors, each with a different role, who will all work together to evaluate the best treatment options. To help guide your personalized care, you're encouraged to discuss your life and treatment goals with your family and friends first. Then communicate them to your healthcare team, as it's important for your team to know what's important to you. The health information contained herein is provided for educational purposes only and not intended to replace discussions with a healthcare provider. All decisions regarding patient care must be made with a healthcare provider considering the unique characteristics of the patient. Now let's meet your healthcare team. You may also hear your team referred to as a multidisciplinary team, or MDT. This means that it's made up of different types of healthcare professionals with different specialties. While you may only work with some of the people in these roles depending on your treatment, here are some of the main ones you may meet. You're probably most familiar with your general practitioner, or GP. They may have been the first person to raise the possibility that you need further tests or may have lung cancer. Or they may have referred you to a pulmonologist, a medical doctor who specializes in the diagnosis and treatment of lung disease. As part of the diagnostic process, a pulmonologist may need tests to make a diagnosis and recommend treatment. These tests may include an X-ray, a computerized tomography, CT scan, a positron emission tomography, PET scan, or a biopsy with biomarker testing to give your doctors a more complete picture. An oncologist can help to manage your whole cancer treatment plan and is often the key healthcare professional who collaborates with other members of your healthcare team. For optimal care, it's important for all cancer patients to have an oncologist on their care team, no matter their treatment type, stage, or monitoring. After you have discussed treatment options with your provider, it may be helpful to get a second opinion. Lung cancer treatment approaches aren't one size fits all, and hearing a different view on your specific treatment plan can help you feel sure about your next steps. Getting a second opinion may help ensure you have explored different treatment options, while also helping you find the right doctor for you in terms of communication style. If you're comfortable speaking with your current physician about seeking a second opinion, they may be able to recommend other practitioners. If it's determined that surgical resection, also known as removal of your cancer, is an option, then a surgeon is the healthcare professional who would be consulted. You'll probably see nurses most often. They'll work with all the doctors on your team throughout your care. Depending on where you were treated, you may also have a treatment coordinator, nurse navigator, or a contact nurse to help with your overall treatment plan and appointments. A radiation oncologist is a highly trained doctor who specializes in radiation therapy, which uses carefully targeted doses of high-energy radiation to kill cancer cells. A pathologist determines the type and stage of lung cancer. You probably won't meet with them, but you will receive their pathology report. Radiologists play an important role in determining the detection, diagnosis, staging, and management of lung cancer. There are additional specialists who may help with other issues involving your treatment. Learning how to communicate and partner with your healthcare team is one of the most important things you can do as you work together towards the same goal. They will play an essential role in determining the course of your treatment and its success. Now, let's recap what we just learned in this section before we move on. What to know. Not all lung cancers are treated in the same way. You may be treated by several different doctors as part of a multidisciplinary team. Nurses and other specialists will play a big role in your overall care. What to do? Consider getting a second opinion. Don't be afraid to ask questions. Choose an oncologist to be part of your healthcare team. And share life and treatment goals with your team. And now we're on to our next destination, Lung Cancer 101. It's important to know that not all lung cancers are the same. A diagnosis can differ from person to person. There are two major types of lung cancer. Non-small cell lung cancer, which you may hear referred to as NSCLC, and small cell lung cancer, which you may hear referred to as SCLC. While lung cancer may be caused by factors such as smoking, exposure to radon, and air pollution, we don't know what causes every case of lung cancer. It's important to know that anyone who has lungs can get lung cancer. Non-small cell lung cancer and small cell lung cancer are different. While non-small cell can grow anywhere in the lungs, small cell tends to start in the airways in the center of the chest. After the type of lung cancer has been identified, doctors will determine if the cancer has spread, and if so, how far. This process is called staging, and it's one of the most critical steps to establishing a possible prognosis and treatment options. There are 4 main stages of non-small cell lung cancer, stage 1 to stage 4, with substages within each. The stages are represented by a combination of numbers and letters and may be expressed by Roman numerals. These classify the tumor based on its size, location, and if it has spread to the lymph nodes or other organs. The higher the number, the more the cancer has grown and/or spread. When treating non-small cell lung cancer, biomarker testing can provide a more complete diagnosis. These important test results can help guide you and your healthcare team towards a treatment that has been shown to benefit people living with your type of lung cancer. Biomarkers are molecules that can be found on the surface of cells or in the genes. They affect how cancer cells grow, multiply, die, and respond to other compounds in the body. They can also help predict how well your body may respond to a class of treatments called targeted therapy. This type of treatment may reduce the risk of lung cancer from coming back or block it from growing and/or spreading. Some of the most common biomarkers are ALK, BRAF, EGFR, NTRK, PD-L1, and ROS1. It's important to ask your healthcare team about biomarker testing. Biomarker testing is recommended for lung cancer, and results may take 10 to 14 days. You'll discuss this with your doctor before deciding on a treatment. We'll learn more about biomarkers later. Next, let's discuss small cell lung cancer, which is typically grouped into 2 stages, limited and extensive. Limited stage means the cancer is confined to one side of the chest. It may have spread to the lymph nodes on that side, but it hasn't spread to the other side of the chest or any other organs. Extensive stage means the cancer has spread from one lung to the other, to lymph nodes on the other side of the chest, or to other parts of the body. While this was just a brief overview, your doctor will get into the specifics about the type of lung cancer you have. It's essential to ask your healthcare team the questions you have about your cancer. Prepare a prioritized list of questions and bring it to each appointment. The more information you have, the more control you'll feel. You may also want to have someone attend appointments with you as a second set of ears. They can help you take notes and ask additional questions. Now, let's review what we've learned. What to know? There are 2 main types of lung cancer, non-small cell and small cell. Staging informs your treatment options, and biomarker testing results may help guide you to the right treatment options. What to do? Prepare a list of questions for every appointment to ask your healthcare team. Learn more about the stage and type of lung cancer you have. Ask your healthcare team about biomarker testing. Now, we've arrived at the treatment section. People have expressed that they feel relieved once a lung cancer treatment plan has been established for them. Lung cancer treatment will depend on a few key things, including cancer type, stage, overall health, biomarker test results, and your treatment goals. It's important to share your feelings about your goals with your healthcare team and discuss how to maintain your health and overall quality of life during treatment. When making lung cancer treatment goals, ask yourself two important questions. What are my goals beyond treatment? And how can my healthcare team help me create a realistic plan that achieves these goals? The answer to these questions can help inform a treatment plan that is best for you. Lung cancer is different for everyone, and there are several options for treating it. Now, we'll go over the most common ones. You, your loved ones, and healthcare team will discuss what's best for you, whether it's one treatment or a combination of the following, depending on stage and type. Surgery may be an option, depending on the cancer type, location, stage, and other medical conditions. If someone has lung cancer that can be removed by surgery, this is called resectable. The goal is to remove the tumor. Surgery is the best option when the cancer is localized and unlikely to have spread. Recovering from lung cancer surgery can typically take weeks to months. Before surgery, you may start with a treatment that reduces the size of the tumor first. This is called neoadjuvant therapy. However, after surgery, there may be a chance the cancer could return, progress, or spread. This is called recurrence. To help reduce that risk, other treatments may follow the surgery. This is called adjuvant therapy. Chemotherapy refers to a single drug or a combination of drugs used to destroy or prevent the growth of cancer cells. It is also referred to as systemic therapy because the drug travels through blood to cells all over the body, aka your system. It may be given as a pill or as an infusion into the bloodstream. Radiation therapy uses high-energy X-rays to destroy or damage cancer cells to keep them from growing. Radiation therapy is considered a local treatment and only affects cells in the area where the radiation is focused. Sometimes, chemotherapy and radiation therapy are used together. This is called chemoradiation therapy, or CRT. These can be given at the same time and usually last 6 to 7 weeks. Think of this as two treatments working together in different ways to increase the effects of attacking the cancer cells. Radiation and chemotherapy are treatments that can be used alone, in combination with each other, or with other treatments, such as surgery, targeted therapy, or immunotherapy. Targeted therapy focuses on and targets cancer cells to reduce the risk of lung cancer from coming back or blocking it from growing and/or spreading. Because it's targeted, it's less likely to damage healthy cells. Targeted therapy is usually given orally in pill form. Immunotherapy is a type of treatment that helps your own immune system recognize and destroy cancer cells more effectively, and is usually given as an infusion into the bloodstream. Immunotherapy can be used with chemotherapy as a combined therapy, before or after using IO treatment as a standalone therapy. A relatively new class of targeted cancer drugs is antibody-drug conjugates, or ADCs for short. Antibody-drug conjugates deliver chemotherapy agents directly to cancerous cells. In addition to the type and stage of lung cancer, biomarker testing may be used to determine if one of these treatments might work for you. Now, there's a lot of enthusiasm around newer cancer therapies, both those that have been recently approved and ones currently making their way through clinical studies. Clinical studies are carefully monitored research studies. Depending on the type of lung cancer you have, a clinical study may be an option for you. Talk with your doctor about whether a clinical study is the right treatment decision as soon as you begin exploring your options. Your treatment plan may also include pain and symptom management. Palliative care, sometimes called supportive care, focuses on the whole person, from physical to psychological burdens. It can be incredibly helpful in managing pain, symptoms, and side effects at any point during treatment. This type of care is provided by a trained team of specialists, like doctors, nurses, and social workers. Palliative care also focuses on reducing stress and anxiety in a variety of ways that can help improve the quality of life for you and your family. A cancer diagnosis can affect emotional health. In addition to changing roles at home, school, and work, it's important to recognize new feelings and express the need for support. It is used at any age and at any stage. Palliative care is not the same as hospice care. Hospice care focuses on the quality of life and compassionate care for people who are in the last phases of their illness. It treats the person and the symptoms of the disease rather than treating the disease itself. When recommending a certain treatment, your doctor will most likely consider data from clinical studies that show how effective that treatment is. Here are some of the terms that you may see and hear. Disease-free survival, DFS, is how long after primary treatment that the patient survives without a sign of that particular cancer. Progression-free survival, PFS, is the length of time during and after treatment that a person lives with the disease without it getting worse. Overall survival, OS, is the length of time from either the date of diagnosis or the start of treatment that people diagnosed with the disease are alive. Remission means the signs and symptoms of cancer have decreased or disappeared. Partial remission is when some, but not all, signs and symptoms of cancer are no longer present. Complete remission, where all signs and symptoms of cancer are no longer detectable, is also called no evidence of disease, or NED. So once again, here's what to know and what you can do. What to know. There are different treatment options with different methods of administration. Options are unique to the type of cancer you have. Palliative care is for everyone, at every stage. What to do? Discuss all treatment options, including the benefits and risks of all treatments available to you. Consider clinical studies. And while it's not always the case, side effects do occur. Let's discuss that next, and how to best deal with them if they occur. When starting any new treatment, it's important to discuss possible side effects of your treatment with your healthcare team. Knowing what may arise can help you know what to do in the case of a severe reaction. It will also prepare you to take steps to minimize any discomfort. These are some side effects of the most common lung cancer treatments: pain, discomfort, exhaustion, nausea, diarrhea, rash. It's helpful to write down how you're feeling and track your side effects. Consider it a roadmap of your day-to-day experiences. You can even take notes on your phone or on an app. Note changes and track your progress so you can remember what to share with your healthcare team. Depending on the severity, you may want to share this immediately or wait until your next appointment. It's important to let your healthcare team know of any changes you notice in your body. Sometimes a small or seemingly insignificant side effect can become serious if it's not addressed early on. Your healthcare team will help assess your progress and health throughout treatment with regular physical exams, medical tests, and scans. If you had surgery to remove a tumor, you will receive radiologic scans of your body to check for its response to treatment, potential recurrence, progression, or spread of the cancer. These follow-up scans are an important part of your treatment and care. You may feel what people refer to as scanxiety, which is the worry that accompanies follow-up lung scans and the results they may bring. Talk to your family and friends about how you are feeling. You can even learn from people living with lung cancer how they've dealt with this stress in between scans and while waiting for results. If possible, try using mindfulness apps and/or listening to soothing music in preparation for your scans or during them. We will talk more about this in our next section, support. But first, let's recap. What to know. Communicate with your healthcare team. Know most common side effects of your treatment. Monitor lung cancer with regular scans. What to do. Continue to have dialogue with your doctor about side effects. Keep track of your progress. Share any positive changes. Connecting with people going through the same experience as you can be incredibly helpful. This can be a great way to gain emotional support, educate yourself about your diagnosis and treatment options, and help others in return. So where can you go to seek support? Family and friends, online communities, local lung cancer support groups, patient advocacy groups, and employee assistance programs. Ask your healthcare team about different support groups, and also do some research on your own or with loved ones. Support can look different for everyone. Support can be one-on-one conversations, an exercise class, nutritional tips and recipes. The list goes on. The support you get from a group can be just as important as the treatment you receive. And when it's from people who have walked in your shoes, it can be especially helpful. Now, let's hear from Jody, a woman who's living with lung cancer. Here's her story about the impact her support group has had on her life.
I didn't have people to talk to about what's lung cancer all about. And finding the support group filled that gap. And that's not to say that there isn't significant support coming from family and friends, and even friends who have been on their own cancer journey. There's lots of similarities, particularly the emotional side of what happens. But I think for me, lung cancer was such an out-of-the-box diagnosis that not having anyone to talk to who's had the same disease can be really quite isolating. And on those days where you don't feel so great and you lose that positivity, knowing that there's a group of people there that I can contact and talk to made a difference.
Jody was navigating her diagnosis alone until she found a great support community.
I decided to seek out the group because after about 6 months, I was ready to talk about what was happening. I think in the early stages, your head's so muddled around it was a diagnosis we didn't expect. We thought that I had the flu. We have no history of lung cancer in our family, so it wasn't on the radar at all. But over a period of time, I felt like I needed to connect with other people.
Through the support group, Jody realized just how important having the right members in her healthcare team could be.
In the support group, we do talk a lot about who our treating specialists and allied health professionals are. And it is important to understand where each of those specialists fits in your journey. But I think the most important part of being in that support group was identifying that I did need an oncologist, and connecting the dots with that person was critical. But we all talk about, whether we see a physiotherapist or an occupational therapist, or whether we talk to our psych, and where we access our support from that clinical and allied health perspective.
So you can see the powerful impact a support system can have. Sharing your story and being a good listener not only helps you, but also helps other people know they are not alone. For Jody, that means sharing what she's learned with you.
My tips for a newly diagnosed lung cancer patient would be ask as many questions as you want to. There are no silly questions. Have a support person with you at every appointment. Someone that you feel safe with, that you trust, that you can relive the conversations with. Keep a journal. Keep a register of the questions you have so that you can share them with people, but also have a place for writing down how you're feeling, because sometimes that's a really good outlet to just say, I feel like crap today. And writing that down and unpacking it a bit as to why can be really therapeutic.
Okay, Let's review what we just learned in this section. What to know. Support can be an important aspect of your treatment. There are many ways to seek and find community. Support looks different for everyone. What to do. Find the support that's right for you. Ask loved ones to help you search. And share your story if and when you're ready. As we're approaching the end of this video, I hope you found all this information helpful. We don't expect you to remember everything, and we encourage you to come back here and watch this again, as well as share it with your loved ones. The most important thing you can do right now is to be kind to yourself as you navigate the emotional ups and downs of your diagnosis, especially in these early days. So before we part ways, let's review a timeline of what you can expect over the course of treatment, starting from detection. Once lung cancer has been detected through test, such as a chest X-ray, your doctor may order further tests, including a CT, MRI, or PET scan to confirm the diagnosis. For a more complete diagnosis, biomarker testing may be required to give your doctor detailed information about your type of lung cancer. After your complete diagnosis, treatment may begin. If surgery is part of your treatment, you may be able to go home sometime between 2 to 10 days after your procedure. When it comes to the length of treatment, timing will vary depending on your type of lung cancer, type of treatment, and how your body responds. Talk with your doctor to get a better understanding of your individual treatment plan. Your lung cancer care plan should include maintaining regular contact with your healthcare team for follow-up appointments and testing. Going forward, we hope you'll have clear, informative, and helpful conversations with your healthcare team. And remember that no matter what, you're not alone. Resources and support are out there and right here.